Hello, everyone. In our revision lesson today, we'd be discussing applied tension. Applied tension as a treatment and management technique for anxiety disorders and fear related disorders. This is where we find this particular topic if we have a look at our syllabus. So, if we're talking about a syllabus, when we talk about this particular part of the syllabus that has to do with the treatment and management of anxiety disorders and fear related disorders, this is what exactly am I referring to. So applied tension focusing on treating blood injection or injury phobias. Now, for the purpose of revision, we would be picking up this paper from May-June 2024. This is variant 3.2, and this paper, paper 3, as we're all aware, is of 1 hour 30 minutes, and this happens to be a 60-mark paper. So without any further ado, let's take this ahead. If we have a look at the questions, we all would be aware by now that the first 4 questions in paper 3 are on clinical psychology. So we targeting this question number 1 for today. Craig has a phobia of blood and injections. Craig has a phobia of blood and injections. He watches someone having an injection on television, feels faint, and now he is too frightened to turn on his television. So we're talking about this individual with the name Craig. He has a phobia of blood and injections. What happens is when he watches someone having an injection on television, he feels faint, and now he is too frightened to turn on his television. Suggest how applied tension could treat Craig's phobia so that he can watch television. So, like I say, the purpose over here is to revise a particular topic, to revise the topic to apply tension. And once we're done with the revision, we would move on towards seeing how this particular question can be answered. Moving on, as we speak about applied tension over here, what exactly is applied tension? Applied tension, to begin with, is a behavioral therapy. Applied tension is a behavioral therapy that is used to treat blood injection or injury phobia, specifically addressing the fainting response associated with this condition. So, specifically, you're trying to address the fainting response, which is a physiological response which is associated to this particular condition. So this being a physiological response, keep this in mind. Now, everyone should keep this in mind that when we talk about blood injection injury phobia, this particular type of phobia requires double attention. One, you need to address the frightening part, or you need to address the fear related aspect, and on the other end, the physiological aspect of fainting also has to be taken into account. The physiological aspect of fainting also needs to be looked after. So fainting in blood injection injury phobia occurs due to a vasovagal response where blood pressure and heart rate drop suddenly in reaction to phobic stimulus. Applied tension helps counteract this response by teaching the individual to increase the blood pressure, reducing the likelihood of fainting. So in a simple manner, what you're trying to do is you're trying to counteract the response of your blood pressure and heart rate dropping by keeping the blood pressure increased so that the likelihood of fainting reduce. Now, moving on, how does this particular technique work? Number one, you as a patient are taught how to tense your muscles. The individual learns to tense their so the individual learns to tense their major muscle group, that is arms, legs, and abdomen, for around 10 to 15 seconds without holding their breath. This increases blood pressure and improves circulation. So, what does the patient have to do? The patient is expected to tense their major muscle groups. Major muscle groups such as your arms, your legs, and your abdomen for around 10 to 15 seconds without holding your breath. This increases the blood pressure and improves circulation. Of course, if your blood pressure would increase, the likelihood of you fainting would automatically reduce. Number two, releasing tension. After tensing the muscles, the person relaxes the muscles for about 20 to 30 seconds before repeating the process. This cycle helps regulate the body's response to stress. So, after you've tensed your muscles, you relax your muscles for about 20 to 30 seconds before you could repeat the process again. How does this help? This particular cycle helps regulate the body's response to stress. Number three, exposure and practice. Once the technique is mastered, mastering the technique is pretty essential over here. Once the technique is mastered, the therapist gradually exposes the individual to the feared stimulus, that is maybe needles or blood, while using applied tension to manage their physiological response. So as a patient, the therapist tries to help you master this particular technique, and then through a very slow and gradual process, the therapist would expose the individual to the feared stimulus. Moving on, if we speak about the effectiveness of this particular treatment or management technique, applied tension is seen to be highly effective for blood injection injury phobia, as it specifically targets the physical symptoms, enabling individuals to confront their fears without fainting. With repeated exposure and practice, the person often gains confidence and reduces their overall fear response. Now, I hope this quick little revision must have helped you recall what applied tension was. And if you were someone who did not know about this at all, I think this content that you all see on the screen is again helpful. Now, moving on towards the question that we had initially read, if we speak about this question over here, the question read, Craig has a phobia of blood and injections. He watches someone having an injection on television. He feels faint and now he's too frightened to turn on his television. Suggest how, this is the question, suggest how applied tension could treat Craig's phobia so that he can watch television. If you are to score full marks, you must give reference to Craig's need to the applied tension or tensing muscles while he's watching television. Now, do not just get carried away writing down about applied tension. Remember, this is a question asking about this particular individual, Craig, who is in a problem, and the problem needs to be sorted. Must be in context to achieve 3 to 4 marks. Must be in context. In other words, you should give reference to watching television, and all of this having to do with the trauma that the patient had experienced by watching, by watching, what was it? Yeah, by watching injection on television. Now, moving on, you can achieve 1 mark for tensing muscles and the second mark for approximate timing of tensing or relaxing. Example, you could say he should tense his muscles for about 10 to 15 seconds and then relax for about 20 to 30 seconds. So relaxation on its own, if you're trying to write down about relaxation, that would not give you any mark at all. Having a look at the marking criteria and then moving on towards the example over here. Award 3 to 4 marks for a detailed answer. Detailed is essential. Remember, this was a 4 mark question. For a 4 mark question, you get 6 minutes. So if you are spending 1 minute to be able to be sure that the content that you want to write is actually in context and is meeting the requirements of the question, that would at max take a minute. And then I think 3 to 4 more minutes, and you'd be able to write an amazing answer. You're still saving a minute or two. Now, award 3 to 4 marks for a detailed answer with clear understanding of applied tension linked to treating Craig's phobia so he can watch television. If we have a look at the example, Craig should go to the therapy to learn applied tension as he's likely to feel faint or actually faint when he tries to watch television. During the therapy, Craig can learn to tense his muscles when he sees the television or tries to switch the television on. Craig should practice this several times a day and he will find that he can watch television without fainting. Now, see, this is a super simple topic and this is a super simple question. But I'm telling you, when we have a look at the scripts, when we look at the answers that students write, they fail to cater to the most basic requirements. One of the reasons why we're doing these revision lessons is to show you these marking schemes, the marking criteria, the example responses over and over again so that you adapt to them, so that you understand what the requirements of CAI are like. Because, I mean, knowing applied tension and not being able to get 4 on 4 on this particular question, I think would be a bit unfair, of course. I mean, you need to ensure that you're not missing out on a single mark. I hope this was helpful. Thank you.